It has been nearly 5 years since man-made chemicals known as PFAS were discovered in a major drinking supply well in the former Pease Air Force Base in New Hampshire.
The chemicals are linked to a number of health problems, including thyroid issues and kidney cancer. A federal health study is finally set to begin late this summer. But as News Center's Vivian Lee reports, answers about the potential health impact on thousands of people, including children, may still be years away.
Andrea Amico's husband and 2 children were exposed to multiple PFAS chemicals from contaminated drinking water in a city-owned well on the former base. Her kids were among hundreds of children at 2 daycare centers.
First 2, continue discharging.
The toxic substances were in firefighting foam used during training exercises before Pease closed in the early 90s. The chemicals seeped into the base's drinking water supply for decades. The well was shut down in 2014. Tests later revealed PFAS levels higher than the general population in the blood of thousands of people, including Andrea's family members. The class of chemicals are linked to cancer, immune system dysfunction, and other health problems.
I know that my family's levels were really high in 2015, but I don't know where things stand now. We've been waiting a long time for our study, so I'm just happy to know that there's a light at the end of the tunnel.
Thursday, before a community panel, federal health officials announced that a first-ever $20 million study is set to get underway at 6 different sites across the country. A separate and smaller Pease-only study will begin in August. Now, the study will follow 350 children who drank water here at Pease from 2004 to 2017, and 1,000 adults 18 and older. And federal health officials are still trying to figure out a way to collect information from those people who want to participate in the study. The wives of Air National Guard members who served at Pease say their husbands' lives were cut short by organ-related cancers. They believe long-term exposure from toxic chemicals and contaminated drinking water played a big role, and they want the military to launch a health study as well.
And you would walk in there in an asbestos suit.
Ann McCurry's husband Ed served as an Air Force firefighter at Pease in the early 60s. His unit conducted training exercises setting fires with discharged jet fuel, paint solvents, and putting them out with firefighting foam. He died of bile duct cancer at the age of 56.
And my husband walked into that with every chemical you can think of, and they would set it on fire.
The Air National Guard is expected to push for a study separate from the federal health investigation. Federal occupational safety officials are also waiting on possible funding to conduct a probe into firefighters exposed to PFAS chemicals at Pease. In Portsmouth, New Hampshire, Vivian Lee, News Center, Maine.
Andrea Amico, who founded testing for Pease, attended the State of the Union address earlier this week in Washington, D.C. The mother of 3 attended as the special guest of New Hampshire Senator Jeanne Shaheen to highlight the importance of PFAS contamination issues. Amico also attended a Senate dinner with Shaheen and met a number of senators, including those from Michigan and Colorado. Those states are also experiencing serious PFAS issues.